Opioid overdoses have reached record levels across the U.S., and there's no sign of them slowing down anytime soon. The abuse of prescription painkillers and the resurgence of heroin are leading to overdoses on a daily basis.
It's the #1 drug problem in our country, prescription medication for narcotics.
And it's not just happening in big cities. It's happening in every town, big and small.
It could happen in Holdingford. It could happen in Clearwater. It could happen in Foley.
For instance, Little Falls, they had about 12 overdoses in 8 days with 3 or 4 deaths.
Statistics from the Minnesota Department of Health show 583 people in Minnesota died of overdoses in 2015. That's 4 times higher than in 2000. The Minnesota Department of Health recently reported the number rose again last year with 637 people dying. Nationwide, the numbers are staggering. In 2015, more than 20,000 people died from abusing prescription pain relievers. Another nearly 13,000 died from heroin overdoses. The national numbers are expected to jump dramatically in both 2016 and 2017.
We see this on a daily basis, on a shift-by-shift basis. There'll be somebody that comes in that has opioids as part of their health issue that they sought treatment for.
And it's just becoming more popular because it's just more available.
In fact, U.S. Attorney Jeff Sessions recently called drug overdose deaths the top lethal issue in the U.S. Dr. Kurt Belk is the medical director for the ER at St. Cloud Hospital. He says opioids are highly addictive, difficult to quit, and don't discriminate.
Once you start taking them, you build up a tolerance, and you also have a psychological need for them, and then you develop a physical need. And so patients end up taking more and more and more to achieve the same level of relief that they had or the euphoria that they get. And then eventually they become dependent on them.
The abuse typically starts out with pain pills, but as the addiction grows and more are needed to get the high, people turn to heroin because of the price and availability.
You know, we've had overdoses here where the needle is still stuck in their arm.
Belk says they're seeing opioids on a daily basis at the ER, and paramedics are responding to overdoses several times per week right here in central Minnesota.
So we have patients that come in either having taken an overdose of, or it's part of their kind of drug portfolio that they're utilizing along with some of the other more powerful stimulants and amphetamines.
The reversal drug Narcan is making a difference in saving lives, but it's not slowing the problem of abuse and the rising number of overdoses.
During the week, I would say, 3 to 4 times for sure, where we're having somebody overdose on some type of, opioid or narcotic.
Part of the problem is the heroin additive fentanyl, a dangerous chemical that's proving deadly.
You ever look into fentanyl or carfentanil? The size of a poppy seed is enough to kill you, whether it's absorbed through your skin or breathed in your nose or in your mouth or whatever.
Heroin hasn't always been a problem in St. Cloud, but it is now. Steve Soika is the commander for the Central Minnesota Violent Offender Task Force. He says they saw a big jump in both seized and purchased heroin from 2015 to 2016.
I would say we have what I would call wholesale dealers up here now.
And they're on pace to surpass those numbers again this year.
We're already at 36 grams just to this point this year, so we're 3 times what we were last year.
So what is the answer? Belk says it starts with the doctors.
I think the hardest thing is that it's much easier to write a prescription than it is to sit down and have a discussion with your patient, telling them that the treatment that they need is not pain pills when all they want is pain pills.
Soika adds they can't solve the problem alone.
And it's taking everybody working kind of get together sometimes as a team to kind of combat that problem.
It becomes the disease, it becomes the need.
And Callie Nolden says it culminates with people getting the help they need to break the addiction.
Treatment is going to be the key, and encompassing people with addiction. And more people have an addiction than ever before.
Another challenge is getting a handle on just how bad the epidemic is. The Centers for Disease Control and Prevention is giving Minnesota $345,000 to better track and prevent opioid-involved overdoses. The Minnesota Department of Human Services is also working with the company Fast Tracker to develop a web portal to make it easier to find open spots for treatment.
It is a significant problem that's costing a lot of time and effort on behalf of the doctors and nurses and the care team here, but also to our communities. Loss of work, people that have to utilize some of the social services that are just draining the system because of this significant pandemic that we're seeing of opioid crisis in our country.
Lee Voss, WJON.